Welcome to the Nottingham Clinical Research Bulletin from the Research and Innovation team at Nottingham University Hospitals NHS Trust and the NIHR Nottingham Biomedical Research Centre. Each week we'll be bringing you a potted summary of clinical research and related stories from our researchers. You'll find a link in the show notes for information on pretty much every item. So here we go. Nottingham's Albert Hall hosted this year's National Institute for Health and Care Research Nottingham Biomedical Research Centre conference at the end of last year, and we're going to start by picking up with a couple of the presentations by Nottingham researchers from the day. First of all, cystic fibrosis is a lung condition that affects about 11,000 people in the UK, and our researchers are working on a groundbreaking trial for personalised medicine to treat it. Associate Professor Dr. Helen Barr, who's a respiratory consultant at NUH, described how the work contributes to research into therapeutic, which matches medications to specific types of gene defects for patients with cystic fibrosis.
And these are looking at these people with rare genotypes to see if we can get personalised therapy called mRNA therapy. So that's the blueprint for making the protein delivered to the cells in the lung epithelium to improve the way the body processes salt.
If the study's successful, these will lead to larger trials in a bigger research population.
Our aspirations really are that it's going to be easy to deliver this medication, and it's been a lot of work being done to try and deliver these medications because the respiratory epithelial tissue is really hard to get into. So you need to use viral vectors to get them into the right cells, and there's lots of mucus on the surface of the airway, so it's difficult to get them here. So what we're hoping really is that people can tolerate the medication first of all, and that we can show that actually that it improves the symptoms, both in terms of the quality of life, the lung function, and also helps improve the sweat chloride levels, which is a marker of how the body's responding to the new treatments. I think it's a really exciting time. There's been huge improvements in how genomics have actually led to personalised care and improvement in lung health. But there's also been challenges as well, and there's future challenges to come that we still don't even know what they are yet. So as people are living longer, the disease themselves are changing, and we're having to adapt our research to understand the condition ourselves and also the impact of these. So it's revolutionised areas, but there's still work to be done before we can say the job is done.
There's a fuller version of what she had to say on our YouTube channel. There's a link in the show notes, or you can search for Nottingham Clinical Research on YouTube. Now, the whole point, of course, of clinical research is to find new treatments and get them into NHS service. And that's just what's happened with another study presented at the same conference. This time the therapy is for treatment-resistant depression. Professor Richard Morris, who's the co-lead for Mental Health and Technology theme at the Nottingham BRC and Professor of Psychiatry at the University of Nottingham at the Nottingham Institute of Mental Health, leads the trial, which is called Brightmind.
It gives them hope because there is another type of treatment which is quite different from drugs and psychological treatment or electrical treatments that of course have been around for some time. So I think whenever there is something completely different to offer, then that seems to improve people that are not improved by other treatment, and that gives a lot of hope and confidence to people that they can improve.
Transcranial magnetic stimulation, as the name suggests, uses magnets to stimulate the brain, and the study compared the standard treatment of repeated bursts with a different approach using theta bursts, personalised for each patient. The study showed both methods worked equally well to help depression, anxiety, and the ability to think clearly. Professor Morris again.
And Brightmind provides the data which shows medium-term benefits over at least 6 months, and it shows that substantial numbers of people might benefit from just 1 or 2 courses of TMS. This is a treatment which is quite different from the normal range of treatments that are currently offered in the NHS, which are drug treatments and psychological treatments.
And onto a couple of other studies. If you missed out on our latest chance to discuss research with the people actually doing it, luckily we recorded it. It's on YouTube. There's a link in the show notes, or you can go to our YouTube channel by searching for Nottingham Clinical Research on YouTube. It's also worth exploring the YouTube channel more generally because there's a lot on it. The session itself was about a project to find out if people would be more likely to stop drinking if they received the results of a scan of their liver and then heard from people with alcohol-related disorders. If you've got eczema, it can be difficult to decide if it's best to wash more or less frequently. If you wash, you keep your skin clean, you add water, you're removing irritants, but it can also wash away the skin's natural oils, alter acidity, and ultimately leave the skin drier, and some bath and shower products can damage the skin. So Nottingham researchers are investigating the best frequency for people with eczema to shower or bath. They'll compare the difference between people with asthma randomly divided into two groups. One group will shower or bath once or twice a week and the other every day. They'll do it for 4 weeks and report on the experience. The project is led by the University of Nottingham and NUH, with 4 other universities, Southampton, Bristol, Birmingham City, Imperial and the Nottingham Clinical Trials Unit. It's funded by the National Institute for Health and Care Research as part of a wider citizen science project, the Rapid Eczema Trials. There's a link in the show notes, or you can go to rapideczematrials.org. That's Rapid Eczema, ECZEMATRIALS.org to find out more information. And that's it for now. Thanks for listening. There are links for most of the items in the show notes and more information about research and innovation in general at Nottingham on the Nottingham University Hospital NHS Trust website, which is www.nuh.nhs.uk/research, and on the NIHR Nottingham Biomedical Research Centre website, which is nottinghambrc.ac.uk. Our email and social media links are there too. If you want to stay up to date with the Clinical Research Podcast, you can find us on iTunes, Spotify, Google, and wherever you normally get your podcasts. The more shows are rated and reviewed, the easier it is for search engines to find us. So if you can subscribe and rate and review us, you'll be doing it for science.